pretty much already know what this chapter is about for the most part. So this is the introduction to the body. This is about a middle range lecture time frame and so forth. If you ever get tired during lecture, you are more than welcome to get up and walk or just stand in the back of my classroom. That's the norm for me, and I'm not going to like stop and say, what are you doing? Okay, I would rather you get up, stand up, and wake yourself up a little bit, because it gets kind of comfy in here and so forth, and I understand. So, anatomy and physiology just defined. Anatomy, to start off with here, is the branch of science that studies the structure of the body, how big the heart is. If you were to dissect it, is basically what it means. Physiology, I think, when I think about anatomy and physiology, I think of physiology to me is the harder part to understand of the anatomy. So anatomy is like the actual organ, you're learning about it itself, but the physiology is kind of like how this works, why this works, okay? So when we get into, like, it seems like more the chemical part, the electrical part, and so forth, of how it's working, and so forth. So it describes how the body functions and how does the heart pump and why. So what's going on with the electrical current in the heart, and so forth. So, and then lastly, there's the structure and function, which are closely related as well. So the structure is more anatomy, where the function is more physiology, is the difference. There are some of you, depending on what career path you take from here, you may take a separate course on anatomy and a separate course on physiology. Okay? And then there's some of you, for my bachelor's degree, I had to take a path of physiology. Any of you guys remember what PATH stands for? PATH. Disease. Daisies, disease, right? It's like a path of daisies. So when I'm saying these silly little mnemonics that I just said, they did a Dean Vaughn, which is the medical terminology program. And so sometimes I will ask, what does PATH mean? And that's just to kind of help our mind medical terminology. So pathophysiology is the study of disease and how that happens. So some of you might end up taking that course as well. What?
So she's lucky.
I don't know. She took a course on her own, so yeah. The body's levels of the organization. The organization is from simple to complex. So we start off, of course, with like atoms, molecules, and go into cells. Cells is like next week, okay? You also need to pay attention real quick. I'm going off that we don't do chapter 2 in A&P, so don't work ahead and go on and do chapter 2 in your workbook. We do chapter 3, and you'll see that on your syllabus, by the way. Okay? So back to this. Starts off with atoms, molecules, cells, then a bunch of cells equal a tissue group. Tissues are, or groups of tissues are then organs. Groups of organs are organ systems. And then you have the human body itself. So I have four or five or so of the different systems, 4 actually, of the different body systems hanging on the wall in here. I don't have them all. So those are the ones that we're getting ready to go over here. But start off here talking about the skin. So that is called the integumentary system. It's the skin, your hair, your nails, and so forth. Next up is the skeletal system. I think you probably all know what that is. That's the bones, the cartilage, and your joints. The muscular system is the skeletal muscle, cardiac muscle, and smooth muscle of 3 types. And nervous system includes the brain, the spinal cord, nerves, and sensory organs. The endocrine systems, this is one of the harder systems for me, or was for me to understand growing up and so forth, but it's so interesting. And this system is all about the glands and the hormones that they secrete. So when we think about endocrine system, a lot of people just think about, okay, that's a system that has a lot of diabetes work in it, okay, because that has to do with a gland. But there's other hormones and glands that are important in our body as well. But that is when we will talk about diabetes the most. The circulatory system, this is the blood, the heart, and the blood vessels all together. You might have broken, last year you might have had like a system just over the heart, and then you might have done circulatory as well. I think that might have been in that book that way. But this year it should be blood, heart, and blood vessels all together. The lymphatic system, this is our immune system basically. We have lymph nodes throughout our body, not just back here and underneath our neck that our doctor feels, but they're actually everywhere in our body. and these help fight against different pathogens and so forth. We have the respiratory system, which helps us breathe, so that includes our lungs and exchanges oxygen and CO2. The digestive system, you guys remember, did you guys ever watch that, what's that show? Oh, Magic School Bus.
Yeah.
What's her name?
Miss Frizzle.
Miss Fritzl, okay. I remember that so vividly from, like, elementary school, that we watched a Magic School Bus on the digestive system, and I remember thinking, this is so gross, but okay. So anyways, she traveled throughout the digestive system, and so forth. So the stomach, the esophagus, starting at the mouth, and so forth. So ingesting food and breaking it down. The urinary system includes the kidneys, and main goal there is to excrete or get rid of any waste products in your body. And then the reproductive system at the end here. So the reproductive system, what else? Urinary, and possibly digestive, we won't even be getting to for quite some time. Okay, quite some time. So this is going to be pictures of the systems that I just talked to. The skin or integumentary, skeletal, muscular, lymphatic, I'm thinking of something else. Nervous system here. So it's showing all the nerves that go throughout your body, including the brain, the spinal cord, and so forth. The circulatory system, including your heart and all your arteries and veins. Arteries are what color in pictures? Arteries. Arteries are what color? There's blue and red up here, so you have a 50-50 chance. Try again.
Red.
Red. Arteries are red on all illustrations because they're carrying oxygen-rich blood. So the oxygen is still in it, so it's bright red. Okay. If it's illustrated as blue, then that means it's veins. Okay, and veins are carrying back to the heart unoxygenated blood. So it's blue, it's cyanotic. Cyan means blue. Okay, that means there's no oxygen. So if you cut yourself on the skin, just like right here, your blood is not blue, okay, but it's a darker color. If you cut yourself on an artery, and I really hope you don't, but you can and still live and just be just fine, not to freak you out. But if you get arterial blood on a blood draw or you get something like that, then it's going to be that deeper red color because it's oxygenated, right? It still has the oxygen in it. So that's going to be the main differences there. Then the endocrine system. So you have glands in your brain. You have the thymus butterfly shape, or the thyroid, butterfly shape up here in your neck. Then you have another butterfly shape down here in your chest, that's the thymus. And when Emma brings in some organs, a lot of times that thymus is still connected to that heart, and it kind of looks like a flap of fat on there, but it's really the thymus gland. Then you have some glands here located on top of your kidneys, and then your pancreas is the last one. And then lastly, the reproductive glands as well. So then, here we go over to the lymphatic system. In this picture, it's green. I'm really used to it being yellow, so that's why I thought back on the nervous system. Anyways, your lymphatic system is one that a lot of people don't know a lot about, but it is throughout your entire body, and is unfortunately responsible for like cancer spreading and so forth, okay, because it goes throughout our whole body, and so sometimes that's the reason being, if we can't catch it quick enough. The digestive system here, a lot of different organs here. The respiratory system. Anybody in here interested in being a respiratory therapist? I've had a few over the years, but not tons. Respiratory therapists are
Maybe bring you a pair of lungs.
okay. All right. Well, yeah. So I've been trying to talk to students more about respiratory therapy. It's a very good career, but you just really concentrated on the lungs, and it's a really good career as well. The urinary system, the reproductive system, and then being last. Forewarning, in this class, especially with our CNA books, you're going to see everything. Real pictures of vaginas and penises. It's just what we have to do, okay? So, I know at first we may giggle a little bit, and that's fine. Like, do you know what I'm saying? But just forewarning, you're going to see real pictures. To my 5-year-olds, I say penis and vagina because it's just a thing for me. And I know, like in court cases, if the child said they touched my hoo-ha, then that court case will be thrown out. And then a child predator is left on the streets because they didn't know what a hoo-ha was. Maybe that was somebody's arm, okay? So that is the little quick short tangent there. So that's why I have even my own children use the words penis and vagina. So forewarning though, I know these pictures can sometimes be graphic and so forth, but it's real life. So you're going to be seeing those for sure. All right, homeostasis. We talked about this yesterday or the day before. Creating a balance, right? Keeping everything staying the same, keeping a balance in so many ways, not just your body, but that's the main thing that we're talking about here with AMP, but everybody's body as well. So it's the body's ability to maintain a stable internal environment in response to changing external environment. So we sweat, right, when we're hot, right? So we're sweating because our body is trying to keep homeostasis. It's trying to get rid of that heat internal because it's trying to keep our body temperature at what? What's our internal body temperature as humans supposed to be? Anybody know what a normal temperature is?
98.
Yeah, you're really close. 98. It's really 98.6. But then I'm going to teach you guys eventually, oh my gosh, well, if you take it rectally, it's this. If you take it under the arm, it's this. If you take it in the mouth, it's this. But just general terminology or knowing a normal body temperature, it's a little bit different in animals, but not far off, okay? But it's 98.6. So sometimes as a nurse, be like, oh, they'd be like, that. I'll be like, oh, the baby's a little bit cool, we need to turn the bed temp up. Well, the mom's like, well, I always run like 97. And honestly, I do too, personally. You guys ever take your temperature just randomly, and you're always like running 97.9 or 9. So I always run a little cooler. Well, that's true, but we still, so you kind of know your normal homeostasis as well, but the exact number is 98.6. So if you have a fever, your body is trying to create homeostasis, okay? It's trying to create that normal environment. If you drink a Pepsi this morning, guess what? My organs are trying to figure out, my pancreas is trying to release insulin to try to create a normal glucose level after I took in tons of sugar. Does that make sense? So everything in our body is trying to create that state of homeostasis at all times, and that's just what it's doing. Okay, that's a normal thing. Homeostatic mechanisms help maintain this, so the temperature regulation, the blood glucose, so that's sugar, blood pressure, and water balance as well. If there's an imbalance, you need to think about things like if you're too hot with hyperthermia. Hyper means above more than normal. Hypo means under, okay? Hypo means under or too cold. Hyperglycemia means too much sugar, and hypoglycemia means a low sugar. All right, guys. Anatomical terms. This is the harder part for us, okay? I want us all to stand up. Let's all stand up behind our desk, please. Stand up, stand up, stand up. So even if you're on the side, so forth. So I want us all to stand with our feet forward. He's standing a little bit apart, and that's actually the truth. But I want you to put yourself in anatomical position. So your thumb should be facing out, correct? Your thumb should be facing out, your face forward, not like I'm doing, and so forth. So this is anatomical position. So anytime you're working on a paper, then it's going to be the opposite, correct? It's the opposite, the right and left sides. So go ahead and have a seat. Go ahead and have a seat. You need to be thinking about true anatomical position because in dealing with patients, no matter what they are, we need to have the correct side, okay? And when it's told us that we need to go in and give the immunization on the right arm, then we need to make sure and do that, even though it probably wouldn't hurt the patient. It's just there are circumstances where it can hurt the patient. I'm sure you've heard of some cases of physicians or whoever being sued for operating in the wrong spot and so forth. But anatomical position is so important. And so then that kind of starts how we describe the human body. So standing up, face forward, arms at sides, toes and palms directed forward. Here we start our directional terms. I told you this is confusing and hard and so forth. It's because, well, here's a term to do superior. Well, superior, I think about the kings of the world, right? They are the highest level, or the president. They are the highest level. They are above everybody. So for superior, we think above a body part. My head is superior to my chest. Does that make sense? It's above, okay? My waist is superior to my feet, okay? But you all have to put it you have to read it how it is and then decide if it's superior or inferior. So with superior and inferior, inferior is going to be the opposite of superior, meaning that it is located below the part or closer to the feet. So the chest is inferior to the head. The chest is inferior to the head. But I started off by telling you the head is superior to the chest. Okay? I can say that over and over again, but if you say it out loud to yourself, that's when it's helpful. Okay? So reading things, and I kind of did that with some of you guys yesterday as we were working through workbook. It's like, okay, it's this way if you read it first, and the opposite way if you read it the wrong way. So please be careful with that. Superior means above, inferior means below. Anterior is going to be the front side. Anterior is going to be the front or belly side. Posterior is also going to be called the dorsal or the back side. Okay? Posterior is your back side. Medial, I always just think about middle. So, right here is this imaginary line, okay, because this is the middle of your body. So, the inside of your thigh here is going to be pretty medial, but one of the most medial points, okay? So medial, think middle of the road. Lateral means away from. Okay, so medial and lateral, those words mean the opposite. Medial meaning the middle, lateral meaning away from. Doctors like to use the word lateral a lot in describing things. Proximal and distal. Proximal means nearest to the point of attachment to the trunk of the body, where distal means furthest away. These tips of my fingers are distal to my elbow, okay? Because they're farther away to the attachment of my body up here. My fingertips are further away. They're distal, further away from the attachment of my body than my elbow is. My elbow's closer. Does that make sense? So, superficial. Superficial means it's just barely, it's on the surface of the body. If you have a superficial cut, that's going to be a paper cut, even though they feel like they're deep. Superficial is going to be just something on the surface. A pimple is a superficial skin problem. Okay, so on the surface of the skin. Skin is superficial, where you need to think about muscles being a deep part. So they are within the part of the body, more further in. Central. When something is central, I don't think you'll have problems with this one. It's an easy one, but we never really see it that much. Okay, of course. So it is located at the center or the heart, for example. And peripheral means away from the center. Or, for example, blood vessels that come off of the heart. They go away from the center. Planes and sections of the body. So there are 3 different planes that you need to remember. And the main thing to remember with them is A here. The sagittal plane divides the body into right and left side. So it basically goes right down through here, and it makes it where you have a right and left side. Okay. A frontal or coronal plane, those 2 words mean the same thing, divides the body into anterior and posterior. So the front of the body versus the back of the body. And this shows a 3D image of that as well. And then lastly, the transverse plane. The transverse plane divides the body horizontally and creates upper and lower body portions. The transverse plane is what a CAT scan or CT scan, that's the same thing, does to our body. That's the images that it provides. Anybody in here ever got a CAT scan? Okay. You really couldn't see necessarily, they won't really show you, but it slices by picture, okay, not really slices, it slices the images on this plane. So they can really see the deepest within your body or whatever organ they're taking a CT of by grabbing that. But a CAT scan has the most radiation and costs the most. And so that's kind of why they leave it for last stitch and so forth. But a CAT scan has to be done to absolutely, or PET scan to absolutely confirm things like masses, tumors, and so forth near the end when they're for sure wanting to confirm it. Regional terms. So yesterday I know there was a textbook question or a workbook question over antecubital. So guess what? There's also an abbreviation for that. It's AC. Does that make sense? Antecubital. So this area right here When I think about it the most, I think about getting labs drawn for there, right? That's where they like to go. That's where some of our biggest, best veins are in there. But so they use the antecubital space. So right here in your elbow, but on the opposite side, is going to be your antecubital or your AC space. Some other ones, let's start back at the top here. Your cranium or your cranium, your cephalic. It kind of shows it, yes, up there on the, as like the forehead, but it's really your whole head is considered your cephalic area, okay? Buccal, buc means cheek, B-U-C-C, so buccal is cheek area. Oral cavity, orbital is your eye, cervical is your neck, sternal is your sternal area. Axillary, we're going to be using the term potentially axillary with taking temperatures underneath the arm. So it's axillary, it's not auxiliary because there's no U there, okay? But axillary is underneath your armpit area. Brachial is where we check a child's pulse for CPR instead of the neck. Do you remember that? Those of you that took CPR with me. So brachial pulse is up here, okay? Antecubital then, digital, it means your fingers, and then let's go back over here, your abdominal area, your flank area, your umbilical area, pubic area, patellar is going to be your knee, inguinal area, femoral is going to be kind of back here in the back, kind of more like this thigh area, and then pedal is always going to be your foot, okay? Caudal, when I think about caudal, I think of like the tailbone, and so the tailbone is technically the bone's called the coccyx, but this is the caudal area up here in the tailbone area. Gluteal, lumbar is lower back, scapular, these terms are all related to the bone, okay? Scapular is that shoulder blade, and then deltoid, that's the same name as your shoulder blade muscle up here, okay? The muscle right up here is your deltoid. So these are all regional terms. Quite a few terms here. I'm going to go over the test with you the day before, so don't stress too much, okay? Cavities of the body. So in the dorsal cavity, there is the cranium or the cranial cavity, which contains the brain. Dorsal means what? Dorsal. The back. Thank you. So think about the cranial cavity, which contains the brain, and the spinal cavity as well. So this is going to be the dorsal side or the back side, where the ventral cavity is going to be this front side here, which includes the thoracic cavity, the diaphragm, which is the muscle that separates your stomach from going into your lungs, and it's really helpful for that. Your abdominal cavity, your pelvic cavity, and then when they like to put those together, they will call it the abdominopelvic cavity. All right, so I just got done talking about all of those, so we'll keep going here. Divisions of the abdominopelvic cavity. So then we have one that's called the 4 quadrants, and that is much easier than the 9 regions. So this is just splitting up the abdominopelvic cavity. When you think about anatomic position, and they do like to abbreviate these sometimes, so right upper quadrant can be abbreviated RUQ, right lower quadrant RLQ, left upper quadrant, left lower quadrant. So the 4 quadrants is pretty easy. Upper, lower, you just need to remember that, and then right and left, okay? This one, it's not that bad, the regions, once you kind of think about it a little bit, because the right side, again, repeats on the left, okay? And then the center is kind of its own thing, but they kind of share as well. The big thing is the center area in the 9 regions is called the umbilical region, and that makes sense. It's around about where your umbilicus is. So on the top part here, on the right and left, is called the hypochondriac area. And chondro, that word right there, means ribs or cartilage. And so if you think about right underneath the cartilage of the ribs, then hypo means below. So below the ribs are cartilage. So hypochondriac region, right, and then left. In the middle here is called epigastric. Epi means above and beyond as well. And so epigastric is above the stomach area. Going over here, right lumbar region, left lumbar region, right iliac because it's on the iliac bone, and left iliac region here as well. And then lastly, down below here is going to be the hypo, so below or under gastric region. we're getting there. I actually think this is the last slide. I was gonna tell you, this one like abruptly stops and it's the oddest thing to me. So anyways, this is the last slide for today. Like I said, this didn't really take that long. It's kind of middle of the range as far as the lecture goes. It just kind of depends on which body system we're in and so forth, how long they take, okay? So I don't know how long that was. I'll look at my video. 25 minutes or so.